What does Ozempic actually take from your body? Everyone talks about the fat. Nobody talks about what disappears alongside it. The answer changes how every weight loss drug should be judged. And the real reason might surprise you. Here's the question researchers at the Annals of Internal Medicine just forced medicine to confront. When you lose weight on semaglutide or tirzepatide, the drugs behind Ozempic and Mounjaro, are you losing the right stuff? Because a new analysis published in the ACP Journals suggests the answer is more complicated than the headlines admit. And I'll tell you why that nuance matters more than the fear, in just a second. First, let's establish what we know. Semaglutide and tirzepatide are GLP-1 receptor agonists. They work by mimicking gut hormones that signal fullness to your brain. You eat less. You absorb fewer calories. You lose weight. For millions of people dealing with obesity, that's been genuinely life-changing. The drugs work. That part isn't in dispute. But here's where it gets interesting. Researchers found that patients on these obesity drugs may be losing more than fat. Muscle mass appears to be going down too. And when you hear that, your brain probably jumps to, the drug is destroying muscle. That's the headline version. That's what gets shared. But the actual finding, the mechanism underneath, tells a more nuanced story. And the mechanism is everything. Here's what they don't tell you in the clickbait version. The research points to something crucial. Muscle loss during weight loss on these drugs is likely not a special side effect of the drugs themselves. It's almost certainly a feature of significant weight loss in general. When your body sheds a large amount of mass quickly, through any method, muscle tends to go along with fat. That's not Ozempic doing something sinister. That's human physiology doing what it always does when caloric input drops sharply. Wait, it gets more interesting. This distinction is not a technicality. It is the entire ballgame. Because if muscle loss is a property of the drug specifically, then these drugs have a unique danger that should reshape how we prescribe them. But if muscle loss is a property of rapid weight loss generally, which is what this research suggests, then the question is completely different. The question becomes, how do we protect muscle during any major weight loss intervention? That is a solvable problem. And we already have tools for it. Let's follow this implication chain all the way through, because this is where it gets genuinely world-changing. Step 1. Obesity drugs cause weight loss. Step 2. Weight loss, at scale, reduces muscle mass alongside fat. Step 3. Muscle loss, regardless of cause, has real consequences. Muscle isn't just about looking fit. Muscle is metabolically active tissue. It burns calories at rest. It supports bone density. It governs insulin sensitivity. It is, in a very real sense, your body's long-term metabolic engine. Which means, step 4, if tens of millions of people go on these drugs without protecting their muscle, we could be trading one health crisis for the early stages of another. This was flagged in a Reddit r/science thread discussing the original ACP Journals paper, and the community immediately grasped what the mainstream coverage missed. The drugs aren't uniquely villainous here. The drugs are doing their job. The gap is in how we design the broader treatment protocol around them. Now here's a direct question for you. Have you ever lost a significant amount of weight, through dieting, or illness, or any major lifestyle change, and then noticed you felt weaker afterward? Not just tired. Actually weaker. That's not coincidence. That's the muscle story playing out in real time. And most people who experience it have no idea what happened or why. They think they're just deconditioned. But the mechanism is specific. Without adequate protein intake and resistance-based physical activity, your body has no signal to preserve muscle while shedding fat. It treats muscle as fair game. So here's where the implication chain reaches its final, most important link. If the medical community accepts this research, that muscle loss is a weight loss problem, not an Ozempic problem, then the standard of care for prescribing GLP-1 drugs needs to change. Right now. Prescribing semaglutide or tirzepatide without co-prescribing a resistance training protocol and a high-protein dietary framework may be medically incomplete. Not dangerous in an acute way, but potentially setting patients up for a metabolic deficit that compounds over years. Think about the scale of this. These drugs are already among the fastest adopted medications in modern history. Millions of prescriptions. Billions of dollars. And the clinical conversation around them has been dominated by cardiovascular benefits, blood sugar regulation, and yes, the fat loss results. Muscle preservation has been a footnote. This research suggests it should be a headline. And here's the part that should genuinely rewire how you see this story. The finding isn't that Ozempic-like drugs are dangerous. The finding is that they're powerful enough that losing weight on them follows the same physiological rules as losing weight any other way, just faster and more reliably. Which means the old lessons about weight loss, protect your muscle, move your body, eat your protein, don't get overridden by a new drug. They get amplified by one. Every person on these medications who isn't doing resistance training is running an experiment on their own metabolic future. And most of them don't know it. Not because the doctors are negligent, but because the research connecting these dots is still being published right now. This paper is part of that conversation happening in real time. So if that's true, if muscle loss is a fundamental feature of major weight loss, not a drug-specific flaw, does that mean every diet, every surgery, every intervention that causes rapid weight loss carries the same hidden cost? And if so, why has the medical world spent decades debating the fat loss side of the equation while barely touching the muscle preservation side? The answer to that question might be the most important thing the next decade of obesity medicine has to figure out. If this reframed how you think about weight loss drugs, share it with someone on Ozempic or Mounjaro. They deserve to know what the research actually says, not just the headline version. Follow for more science that goes all the way to the conclusion.